Special.
Blue light special. Yep. All right. Well, welcome everybody. Welcome to our Prevention Research Center for Healthy Neighborhoods monthly seminar series. In light of how cold it is outside, we really appreciate you all coming. And where's Maddie? Did Maddie come down? She's outside. Maddie, we thank you for the hot and warm soup. I think we're all very appreciative of. Thank you for the soup. There we go. So everybody coming in. All right, so as you know, you guys, this is our monthly seminar. We try to focus on things that are important to our local community, research that helps us better understand, in many ways, the environment, the urban environment in which folks here live and the impact it has on their health. We're very fortunate today to have a colleague that is as much as a part of the PRC as he's a part of the Population and Quantitative Health Sciences Department. And I'll introduce him in 1 second. But first, let me just say real quickly that everybody knows that the restrooms are out and around the corner. And Susan has just reminded me that since we are recorded, there is ambient noise that happens. So try to once you're done eating, I don't know, is there any instruction? What makes the most distraction?
I don't know.
It just it picks up.
Yeah.
Could be the speaker. Like
Nonsense. All right, so just real quick too, so next month, which is the March 13th, there's going to be a wonderful, this is great, Monica Webb-Hooper, whose lab is right behind us here. She is the director for the Office of Health Disparities, or Office of Disparities at the Cancer Center. Not sure what the name of the Cancer Disparities Office. In the Cancer Center. She's going to be talking on digital interventions in underserved tobacco smokers, culturally sensitive enhancements. This is a very important topic to a lot of us here right now. As many of you know, that the rate of smoking tobacco use in the city of Cleveland is almost roughly 40%, compared to far less than 17, 16% nationally in the state. So it's a very relevant topic for us. And then we're going to follow it with hopefully another tobacco. Erica Chappell is going to do a presentation in April. We had our research symposium, which we have swapped out for this year. And we're going to focus on another topic, another seminar on breathe free. Okay, so that's an intervention, and Erica will be presenting that. All right, without further ado, I would like to introduce Dr. Jim Spilsbury. So Jim is an anthropologist, as well as having his MPH from UNC. Anthropology is from here, though, yes? Mm-hmm. Yes. Associate professor in our Department of Population and Quantitative Health Sciences, and an affiliated and a colleague here at the PRC. We're very excited. He's going to be talking on his work around neighbors, neighborhoods, and child maltreatment in Cleveland. A very long study, and I know you will introduce your colleagues as well.
Great.
Yes. Okay. Thank you, Jim.
you guys are killing me with this Dr. Spilsbury. Just please, it's Jim. Before I go any further, I just wanted to thank Jill Corbin, who's a co-investigator on this project, for coming and attending too. If you have any difficult questions, please direct them directly to her. So I guess I wanted to preface this talk by saying this is a really large project. It's an NIH-funded R01 thing. And it's still in some respects a work in progress. We still have data that we'd like to analyze. Jackie, I see you in the crowd. We've got we've got electronic maps of people, and 400 adults, what they consider their neighborhoods. They have all sorts of exciting things to do with the geographic data that we collected. So that's sort of out on the horizon. And what I tried to do today was to think of a couple things. One is to try to present some topics that hopefully you'd find interesting. At least I found them interesting. And in some respects, too, to give you a sense of the array or variety of kinds of projects, if you will, that this study has involved. So I like to start with a little roadmap of what I'm doing. Maybe it helps keep me on track. I'm going to say just a little bit about maltreatment, its epidemiology. Then I'll move to the study specifically, talk a little bit about the team, talk a little bit about mixed methods. This we felt was a critical aspect of this project. And then get to sort of the results. And I think I have time. I've timed my talk, believe it or not, a couple times. Should have time to talk about something immediately in progress that we're excited about, and then sort of end with some conclusions and implications. So probably good to begin with a definition of maltreatment, just so we're all kind of on the same page. This I took from the Centers of Disease Control and Prevention. Maltreatment is defined as any act or acts of commission or omission by a parent or other caregiver that results in harm, potential for harm, or threat of harm to a child. And there are sort of two big buckets of maltreatment, if you will. There's acts of commission, and these are deliberate, intentional actions. So think of things like physical abuse, right? Acts of sexual abuse, psychological abuse, that sort of thing. And the other big bucket is more omission, or a failure to provide something that's deemed necessary, right? And so in that bucket, you have things like physical neglect, emotional neglect, medical neglect, dental care neglect. Lack of supervision is put into that category. And it's important to note, too, that harm, when you think about these actions, that harm may not be an intended consequence on the part of the caregiver. So I'm sure this is going to come to no surprise to the audience here. Maltreatment is toxic, it's costly, and unfortunately it's very common in our society. It may have profound effects in virtually every domain of a child. Those effects may persist and exacerbate through adulthood. And the cost in terms of human suffering can't be calculated. But there have been some studies that have tried to estimate the other costs associated with maltreatment, costs that are incurred by our judicial system, law enforcement, by the medical health community, who am I leaving out here? Social services, right? These are enormous costs to society in dealing with maltreatment. And some of these studies, the estimates go as high as $100 billion a year. There is some evidence that child maltreatment has been declining since 1993. This is a graph, and on the y-axis is the number of cases per 1,000 children per year of what's termed substantiated or indicated maltreatment. And what I mean by that, basically, is when a child welfare department receives a report that there's a potential for maltreatment in a case, they'll basically, if they launch an investigation, they'll investigate that case. And then there's three sort of classifications that case may fall into. There's a substantiated, which means that there was the evidence that was present as they did their investigation met or exceeded the threshold for what's considered maltreatment, and that's called a substantiated case. The other end of the spectrum is an unsubstantiated case, so the evidence didn't meet the threshold, right? That's classified unsubstantiated. And then indicated is sort of in the middle, in the sense that there was evidence that maltreatment may have occurred, but it didn't rise to the threshold necessary to classify it as substantiated. So what you're looking here is the number of cases per year over time from 1990 to 2016 of substantiated or indicated cases per 1,000 children. And you can see from like 1993, where it's 15.3 per 1,000 children, it drops to 9.1 by 2016. Before we get really excited about that, and I'm going to return to this actually a little bit later, but before we turn from the slide, I just wanted to say, even with a decrease in absolute numbers, we're still talking about, over 700,000 cases of child maltreatment in 2016, for instance, substantiated or indicated. This is a very sobering number. One thing that seems to be true in terms of maltreatment, or at least the maltreatment rate, is that the rate depends in some respects on the geography. It depends where you live. So what I've tried to do here to illustrate this is the x-axis is 1990 to 2010. This is the child maltreatment substantiation rate per 1,000 children, and this is for the city of Cleveland over that time period. And then I'm just going to show you three neighborhoods that we have been involved in our study. Here's the first neighborhood, and you can see it's sort of a general decline over time. Here's the second neighborhood, and that starts out low and then kind of goes up and down and actually ends up towards 2010 as sort of increasing. And then our third neighborhood is very different. Now I know I should have, what's the word, smoothed these lines a little bit, but this is more dramatic, don't you think? But anyway, just to give you a sense that these rates can be very different in different neighborhoods. And our study basically was set up to try to investigate what's behind those different neighborhood trajectories. So as we put this study together, we conceptualized that what might be behind these different trajectories are sort of three main things. So I'll start from the bottom, that perhaps changing neighborhood conditions, so think poverty, unemployment, those kinds of things, changing neighborhood conditions over time might influence the child maltreatment rate. Similarly, changes in the uptake, the availability, access of social services in neighborhoods, changes in those might result in changes in child maltreatment. And then lastly, the top box involves changes in maltreatment definition, report, and substantiation. And what we were getting, and that should probably say mandatory and non-mandatory instead of professional and non-professional. What I mean by that, both mandatory reporters, so people who are required, legally required to report what they believe may be a case of maltreatment, and then the non-mandatory, so this could be your next door neighbor, for instance, right? And the interesting thing about this top box is that we're talking about things there that they're not the actual maltreatment behavior, right? It has to do with the reporting process, right? How cases are investigated, how they're determined, that sort of thing. But if there are changes in those procedures, then ostensibly that could change the child maltreatment rate, right? So I wanted to mention too that the study builds on a previous investigation that occurred in Cleveland in the mid-90s. Jill, who's here, and Claudia Colton over at our Mandel School of Applied Social Sciences were the co-PIs of this project, Neighborhood and Household Factors in the Etiology of Child Maltreatment, Abuse, and Neglect. I was a humble enumerator and interviewer for that project. A couple things to say. So our current study built on that. It was like a foundation. So this study utilized a mixed methods approach, and I'll talk more about that, but for the moment think about it as a strategic combination of qualitative and quantitative methods to learn more about a phenomenon, in this case maltreatment. And this study really produced some seminal work in the field in demonstrating the association between maltreatment and what are referred to as structural factors. And by those, I mean things that reflect the social or economic structure of human settlement. So think about like the poverty rate, right? The residential instability rate. Those sorts of factors are considered structural factors. And I forget, I should have looked this morning, but this paper they produced in Child Development's been cited hundreds of times. It's no exaggeration to say it was a seminal work. And one thing about this study, though, I want to point out is it was cross-sectional in nature. It relied on the 1990 census, U.S. Census data, if I remember correctly. And one of the things we wanted to take advantage of is to design something longitudinal. We have information back to the mid-90s. Can we look over time and see how changes in things like neighborhood conditions, services, maltreatment definitions, the substantiation process might be related to changes in child maltreatment. So this is our team. I have to say I was most, and am still actually, I am most proud that I was part of this team. One of the things to note about it is it was multidisciplinary. Not only multidisciplinary, it was multi-school, right? We had people from MSAS. I'm from the School of Medicine. Jill is from the College of Arts and Sciences. And we probably don't have enough of these, frankly, in our campus. I mean, really taking advantage of the expertise that is available across the different schools at Case Western Reserve. And this team really represented expertise in, statistical science, demography, the child welfare system, anthropology, cross-cultural child development, those types of things. So it was a real pleasure to be on this team. One of the things that we felt very strongly when we put our project together was that understanding or to investigate this neighborhood maltreatment link required mixed methods approaches. And as I mentioned a little earlier, what I mean by that is a strategic combination of both quantitative and qualitative approaches in a single study. And the idea behind it is using both of those in combination provides a better understanding of a phenomenon than using one alone. And they do that because they're complementary. So the strengths of one make up for some of the weaknesses or limitations of the other. A quantitative, think about getting answers to how much. Think about issue or answers related to generalizability. Do the data that we've gathered, does it generalize? Does it apply to other settings? And while the qualitative part of this can get at the how or why or something, you know, it provides participants voice, detail, description, kind of meat to the bones sometimes that are in the quantitative data. So we felt this was really a critical, a necessity basically for our study. This is a big picture or schema of the sample and data sources. So on the left, it says citywide panel. That's how we actually pitched this to the National Institutes of Health. But actually we used data for the whole county. So we have data for all the 475 tracts in Cuyahoga County. You can see there's a wide range of administrative data that are available. For today's talk, I'm going to be really focusing on data that came from either the U.S. Census Bureau or the Cuyahoga County Department of Children and Family Services. These data reach back decades. And one thing really nice is a lot of it was already available at MSAS. You know, those of you who are familiar with the Center on Urban Poverty, I'm missing something in that title. But if you think Neo-Can-Do, right, if you've used Neo-Can-Do, that's the data that we're talking about. Claudia's shop was doing big data before it was called big data, basically. So that's sort of the quantitative part. And then on the other side here, reflecting some more qualitative parts are our in-depth study of 20 neighborhoods. These were the same neighborhoods, 20 neighborhoods that were studied back in 1995. So we felt it important, and you know, as we conceptualize this project, you know, we had said for a while, I mean, wouldn't it be cool to go back to these places? We were there 20 years ago, see what's changed, what that's meant for children, for families, for maltreatment. So we conducted two qualitative interviews with each of 400 residents, 20 residents in each of the 20 neighborhoods. They also completed this quantitative neighborhood environment for children rating scales. To complement our interviews with neighborhood residents, we conducted a survey with 292 social service workers. And these, our idea was we were trying to get social service workers who are also working in these same 20 neighborhoods. And we were able to do that. We got an average of about 13 per study neighborhood. And then of those 292, 22 of them actually agreed to a follow-up interview. So we did a follow-up interview that was much more qualitative and focused on some of the issues that we were interested in. And all these interviews, these were the domains basically, in broad strokes, asking about neighborhood conditions, asking about quality, asking about the quality, accessibility, use of services, and then questions around definitions of response to maltreatment. And it was really important, given our mixed methods design. I mean, we literally made a matrix. So we knew quantitatively things that we would be looking at, and then we would say, okay, if we're going to ask about this on a quantitative side, what are we going to ask our residents, or what are we going to ask social workers, right? And so we could literally develop like a spreadsheet or a matrix to make sure we had everything completed. We didn't want to end the study and realize, geez, we never asked the social workers about this, you know. But that was a very helpful exercise. And then lastly, we conducted 5 focus groups. And the idea behind the focus groups was, once we got some findings together, we could conduct some focus groups with neighborhood residents and with social service workers, kind of present our findings. see what resonated with those individuals in the focus groups. We had some questions about interpreting some of what we found, and frankly, used it as an opportunity to get further information from them. Here's a finding we're trying to interpret. What might this mean to you? And I'll talk a little bit more about that. The approach was indispensable in several ways. So the quantitative data analysis helped formulate questions for our qualitative interviews. The qualitative data were necessary to interpret some of our quantitative results, and the qualitative data identified additional quantitative analyses to conduct. So it was kind of a back and forth, iterative kind of thing. Both of those both components very important. So today's talk, I'm going to really focus on the two boxes that are in Cleveland Brown's brown, I guess. The changing in neighborhood conditions and the change in maltreatment definition report substantiation. So we'll start out with the top box. And I'm going to begin with the mandatory processes. So this is the official investigation process. So what you're looking at here, so we were interested in seeing, okay, Cleveland, substantiation rate over time from 1990 to 2010. What we're looking at here are box plots, if you're familiar with those. So each year, this is the distribution of the child maltreatment rate for all of the census tracts of the city of Cleveland. So that's done for each of these 20 years. And then this line across is the median value. So half of it's above, half of the tracts are above, half are below. And so you can see that over the whole time period. And notice anything interesting about that figure? Anything catch your eye?
The spread.
Yeah.
Started going down.
Yeah, I mean that's one thing that has caught my eye. So the spread seems to change, and then right around here, we thought this was kind of interesting. What's going on here? I mean, maybe substantiation is decreasing, child maltreatments, or child maltreatments is decreasing in the city. So we wanted to investigate that a little further. So our first thinking was, well, maybe it has to do with the investigation rate. If the investigations decrease, maybe there's fewer investigations, there's then fewer substantiations. But if you see, substantiations are on the top, and the investigations, same idea of box plots, right? Investigations per 1,000 children. Certainly you don't see that drop around 2004. If anything, it looks like investigations sort of slowly rise over the time period. Then there's a drop here. So we're thinking, well, maybe I got it. Maybe there's a difference in the proportion of the investigations. Maybe there's some change over time. There's a greater proportion of mandated reporters, let's say, who are providing these reports. And maybe more of those get substantiated. So you can see, though, in the top figure, the proportion of investigations by mandated reporters stays the same. And this one's really interesting. So this is the proportion of investigations that are actually substantiated or indicated. And that bluish color is for the mandatory reporters, right? And then this reddish brown kind of color that I'm glad my house isn't painted is the non-mandated reporters. And interestingly enough, you see that decline in this time period in both of those. So we thought this was really interesting. And this is where our qualitative component of this project provided what we thought were very useful clues as to what might be happening. So we started doing our interviews with staff at the Department of Children and Family Services, some other social workers, and we learned that there's an interesting event going on around that time, which was basically the reauthorization of the Child Abuse Prevention and Treatment Act, or CAPTA. And CAPTA governs child protective services throughout the United States. And as we went through these interviews with our people from these DCFS, other agencies, what they told us basically was that when this was enacted in 2003, 2004, that there was a change in the legal interpretation that placed more emphasis on parental rights around the investigation process, placed more emphasis on provision of services to family. I wish David Crampton, my co-investigator, were here, because this is his area. He can explain it. But as he's explained it to me, think about a pendulum moving back and forth. And as the pendulum moves back and forth, this bar here is at the threshold for what gets considered or determined to be substantiated or indicated maltreatment. And as the pendulum moves back and forth, the threshold moves up and down. And on this side of the pendulum moving this way, on this is, we're going to do everything we can to protect children. So if that means we over an overabundant or abundance of caution, we remove children from home, that's our prime directive. We protect children. And they would say the other side of the pendulum involves more, what can we do to keep families together, to preserve families, provide services, whatever, but that's sort of the other end. So you could see as this pendulum moves back and forth over the years, something happens, it changes, maybe it goes back a little ways, maybe there's several cases that make the plain dealer, right? And suddenly this is a big issue in the county, and the pendulum moves a little bit. But we think that's what we're seeing here, basically. That drop in 2004, it's not a change in maltreatment behavior, it's a change in the investigation process, or that whole investigation substantiation process. That makes sense? Mm-hmm. I like David, I thought he did a great job with the pendulum. I couldn't understand it. And so some conclusions, implications from this little piece is that one, we think about our box, right? Do changes in this process or something, could they be influencing maltreatment rate? Well, this is evidence that, yeah, this might well have happened here, right? That it was a change in a policy or procedure produced a change in the substantiated indicated rates of maltreatment. Now, the second bullet here is kind of a bummer for us, because we were counting on using the substantiation or indicated rate as our primary outcome variable. So now we're hosed, right? I mean, you're thinking about, wait a minute, how can we use this variable? Because we know that, if you will, it changed its meaning, right, over time. There was a substantial change in what this meant after 2004, perhaps, compared to what it meant before 2004. And so what we ended up doing was switching to the investigation rate. And if you'll remember, that was a little more stable over the time period. That made Claudia's shop a lot happier. And then probably the bigger picture, you remember that figure I showed you earlier that I had the 700,000, very sobering number of cases of maltreatment. So there have been articles about this, suggesting that maltreatment's declined. People have written articles about, gee, I wonder what's causing it. Maybe we get better preventive services or, whatever. And I would say these data could call into question that very idea, right? That if you're looking at a policy change or a procedure change, maybe maltreatment, the behavior, hasn't really changed at all. And especially if this occurs in numerous child welfare departments in numerous counties across the country. So it'd be a real interesting thing to study, to look at that. So I'm going to switch now and talk about the non-mandatory reporters or processes. And our idea behind this, we were interested in trying to understand neighborhood residents' definition and etiology of maltreatment, or what do you think contributes to child maltreatment. And the idea behind this was perhaps perhaps what people think maltreatment is and how they think it comes into being or what contributes to it might influence in some respects how they respond to a potential case of maltreatment. So as a first step, what we wanted to get a handle on here was how do neighborhood residents define maltreatment and what do they think contributes to maltreatment. And we have the advantage here, we can look at this over time. So we've got 2 time points, 20 years apart, interviews with 400 residents per time point, 20 residents in each neighborhood. Just to give you an idea of our samples, both time points, the 2015 group is a little older, but majority at both time points, female, African American, Both lived approximately 11 years in the neighborhood. They'd been there for 11 years on average when we were there to interview them. The household composition similar. The 2015 group was a little more educated, but similar in terms of the percent of residents who were below the federal poverty level. So what we did at each of the time points in the interviews with the residents, we would ask two questions. So one of them would be, it was an open-ended thing. What are 3 things you would consider child abuse and neglect? So they would give us 3 things that they thought were child abuse and neglect. They may only give us 1. Most people gave 3. Every once in a while, someone would give a lot more than 3. I was going to have this and I forget. We got hundreds, and most people gave about 3 examples. And then what we did with those back in 1995 is we developed a coding system, a way to categorize those responses into broader categories that conceptually made sense. And then we even developed some summary categories. So things like, okay, anything involving physical abuse, anything involving neglect, anything involving sexual abuse, those kind of really broad categories. And this was sort of standard, multiple coders doing this independently, a third referee, if you will, coming in to handle discrepancies, so that kind of standard procedure. And then in terms of the contributing factors to maltreatment, we presented the residents with a list of 13 items, and these were items based on the literature and also previous research. So these would be things like poverty, unemployment, lack of family values, stress, those sorts of things. And we would basically ask the residents to rate each one how much it contributed to child abuse and neglect. So 1's nothing all the way up to 10 a lot. And then for the open-ended questions, and remember we got categories here. So the person said ultimately yes. One of the I indicated an example of physical abuse. That's yes, no. We used a logistic regression approach for those. And for the one with the contributing factors, we have more continuous variables, so we used a median regression approach for those. Primary predictor was study year. We did analysis and discovered, interestingly, that the variation or variability between neighborhoods was very small to the variability within neighborhoods. So that led us, much like Sarah's dissertation recently, right? That we could do normally if the variability between neighborhoods was substantial, you would want to do like a multi-level kind of approach to capture the variability at both the neighborhood and individual level. But here this variability between neighborhoods was very, very small, so we felt a one-level analysis was appropriate, adjusted for individual neighborhood characteristics and resident clustering. So remember, 20 in each of 20 neighborhoods. So this is a list. On the left is 1995, on the right is 2015. These are individual actions, and I ranked them. What you're looking at is, so say for the first one, the percent is the percentage of people reporting, right? So 52, a little over half of the people in 1995 gave us one of those examples of tell me something of child abuse and neglect, an action that reflected the deprivation of food, right? And then in 2015, it was 66%. And you see overall, there's a fair amount of, a modest consistency in this list of individual items. I was interested in that sexual abuse in 1995 was the 8th, and it dropped out of the top 10 in 2015. I was interested in that because I would have thought with the press that's been around in the preceding several years with the sexual abuse crisis, those sorts of things, that would be a little more salient maybe to people. But this dropped out, and then these individual items here actually moved up into the top 10 list. And then this is a bar graph showing those big buckets, those summary categories. Bluish is 1995, reddish is 2015. And you can see, the amount or percentage of people in 2015 who indicated an act of physical abuse decreased. The group that indicated an act of neglect increased when you compare those two time points. But I mean, overall, I was sort of struck by the fair consistency, actually. Nothing like revolutionary, you know, in 20 years. Oh, parental misbehavior, in case you're wondering. What that was, these would be actions like, you know, when parents go out all night partying. So it'd be something like that would fall into that category, parental misbehavior. And then these are the results of the multivariate analysis. No surprise, since I just showed you the figure. Sort of corresponds, as you might expect, after adjusting for a number of factors in clustering, that in 2015, the odds of the residents indicating an act of physical abuse decreased, and those indicating an act of neglect increased. And the rest of these, there weren't significant changes. The contributions, similar to the definitions, were fairly consistent. And again, this is 20 years. When you look at these, you're looking at the median and interquartile range, so the 25th percentile to the 75th percentile. And you can see by and large, especially up around the 4 around the top and then the 3 or so down at the bottom, a very, overall fairly consistent kind of rating over this 20-year period. At least with the median score, there's all of these items seem to be important to some people. You know, we didn't see any where it's like the median's 2.
Yeah.
You know, on this 10-point scale. And then these are the results of the multivariate analysis. And what we do observe. Oh well, I should start off saying that if you go back to this, you'll see that the drugs, alcohol, and psychological emotional problems, the medians are 10s and 9s. And as it turns out, there's such little variability that as good a statistician as Francisca is, even she can't wring something out of those, right? So there's just not enough variability to really analyze. But in terms of the other remaining items, you can see that over this time period, there was a higher rating of contribution of single parents to maltreatment in 2015 compared to 1995, and a decrease in the contribution of lack of religion in 2015 compared to 1995. So some of our conclusions, implications. One of the things was that if you were going to develop some sort of prevention or intervention program or something that related in some way to definitions and etiology, those seem like fairly stable items to be able to serve as a stable platform. So you're not seeing like tremendous changes in this 20-year period. We thought too that the consistently high ratings of drugs, alcohol, psychological, emotional problems suggest that perhaps substance abuse and mental health issues might resonate with residents who are concerned about maltreatment, and maybe served as a topic or to be able to begin to coalesce people around. And then in the cultural context of Greater Cleveland, something seems to have changed in terms of this perceived relationship between religion or lack thereof and etiology of maltreatment. And that would be, we can only speculate on what that is. Yeah. Yeah.
Jim, are the ratings of those 13 contributors
Yeah.
in the literature, are those, were you able to look to see how strongly those are associated with actual reasons for reporting?
No,
So,
we haven't done that yet. Yeah. And in fact, while I was thinking about this, I'll show you some data about one of the things we'll ask residents about is what do they think neighbors would do? What do they think they would do in certain situations? And that's kind of a step down the line. It'd be interesting to examine that association between those characteristics. Yes.
Among the options for contributors to maltreatment, was it included abuse as a child themselves?
Yes. A history of, I think, did I not put that on here? Oh, there it is.
So I
Abuse,
think-
neglect in childhood.
Right.
Yeah, yeah. All right, so I'm going to move on this rapid tour through this study to changes in neighborhood conditions and how those might be related to changes in child maltreatment. And you'll notice here I've got the investigation rate. Remember, it was substantiation indication rate. When Plan A don't work, go to Plan B, right? So I'm going to talk a bit here about those structural factors, those things that reflect the social, economic sort of structure of a human settlement. Now, I have to say, when I do this section, I always get a little nervous because Francisca is an expert statistician. This is her baby. I mean, she did this work. She's spearheaded the movement. And I, meanwhile, I'm afraid I'm going to say something that's going to set statistical science back decades. You know, so bear with me. I'll do my best to try to explain things. So here's the question: how are changes in neighborhood structural characteristics related to change in child maltreatment rates, investigation rates? So what this involves is a three-way wave panel study. So data from 1990, data from 2000, and data from 2010. And one of the reasons that the team ultimately felt it would be good to stick to those three waves as opposed to including, I mean, we got some data from 1990 to 2010 every year, but I think there was substantial greater confidence in the variables of these at these three time points, because they're U.S. Census time points, basically. And here our sample consists of 475 census tracts that are in Cuyahoga County. The outcome is a maltreatment investigation rate. And you'll see here are a list of predictors that are in this model. And the selection of those predictors was guided by that 1995 seminal work and then substantive research investigations in the field that have involved other cities that have corroborated those results. And also, another factor is the availability and comparability of variables over time. Unfortunately for us, I suppose, in this study sense, the U.S. Census over those time points changed what it asked. I mean, some questions are removed, some questions are modified. So we wanted to make sure that what we have is consistent across those three time points. And these are the predictors in this model. So they're sort of some of the classic, kind of structural factors. Francisca used this is great, I can blame everything on Francisca. If you have any problems, that's Francisca's decision. Suggested we use a fixed effects model for this analysis. And the purpose to show how change in maltreatment investigation is associated with temporal change in neighborhood conditions. So we got those three time points. We're observing each of these tracts or neighborhoods at, and I know I'm a little sloppy in my language, that we recognize that you shouldn't equate census tract with neighborhood. There are certainly issues around considering a census tract somebody's neighborhood, but that's, if you'll bear with me. Just indulge me in it. Recognize that there are some issues with that. But we're observing let's say each tract at three time points. And in essence, what this analysis is doing is it's comparing the neighborhood with itself over time to be able to estimate these relationships. So it's looking at within changes in these neighborhoods over time, comparative cross neighborhoods over time in a more traditional model. And one of the big advantages to this is that it reduces some bias that may be due to unobserved neighborhood characteristics over time. I hope I didn't set the field back. Did it? Anybody? Okay. Well, another thing we calculated was this statistic, Moran's I, and that basically is a measure of clustering, because we were interested just to see how do neighborhood are certain census tracts clustered in terms of the investigation rate. So this, I have a slide at the end of this, way in the extras, if you want to see the formula. We can look at it afterwards. But basically, the Moran's I is calculated, and it ranges from -1 to +1. And at that end of the spectrum, -1 is perfect dispersion. So think of a checkerboard, right? Everything's sort of perfectly dispersed. And then on the other end of the spectrum is 1, which is perfect clustering. So you can see all the blues are together, all the yellows are together. So these are our study variables over time in terms of frequency and clustering. So if you look, you can see, well wait, did I do this? Nope, I wasn't sophisticated enough to highlight things. But if you look at the top row, investigations per 1,000 children, you'll see that between, I didn't put the 2000 numbers here kind of so it would fit on the slide. So you're looking at 1990 versus 2010. And you can see that over that period of time, the investigation rate increased substantially for children. And remember that in the, the distribution, right, that we saw of investigation, an increase over time. You can see that many of these predictors, these structural factors, also increased over time. Public assistance decreased over this time period. Vacant housing increased. And the percent of African Americans in these tracts increased, and the percent of Hispanics in these tracts increased. And then this is Moran's eye, or that measure of clustering. Remember, going toward ones means more clustering, 1990 and then 2010. And the one I thought I wanted to draw to your attention, because, I mean, there's small changes in these, but a couple of them that are, I thought to point out, was the real decrease in clustering of public assistance, and then this increase in the clustering of vacant housing. So looking at these variables before doing the analysis, one of the challenges is the percent of African American residents in census tracts from a statistical or an analytic standpoint, and this really reflects the history of segregation in our area. And so what you're looking at here, this is a, on the x-axis, this is the percent African American, okay? And the red, see the red line, or the blue line is 1990, the red line is 2000, and the green line is 2010. And what that's showing is, let's look at 1990. There's a large proportion of the census tracts where the percentage of African Americans in them is between 0 and 20%. That makes sense to everyone? And then similarly over here, you can see a substantial proportion of census tracts in the county where there is a large proportion of African Americans, 80% above. And so over time, you can see that it sort of does like this a little bit, right? That the percent of census tracts with a lower proportion of African Americans decreases, and this one increases a little bit over time. And that presents challenges from a well, there are all sorts of implications in this, but let's just stop with, or begin with the analytical aspect of this. It presents a challenge to try to handle this in the analysis. And so what Francisca decided to do was to basically create an interaction term. So what she's going to do is create a categorical variable, and this variable will include these tracts where it's 20% or less, these from 1990, and then these tracts where it's 80% or above, and then the third value of this categorical variable is in between, 25 to 75%. And so then this is a better way to handle this kind of bimodal distribution in the proportion of African Americans in the tracts. And so then we'll put this interaction term into the model, basically. And this helps us then, and you'll see, I think it helps us improve the interpretability of what we see, the results. So here are the results, and the kind of middle column is the fixed effects, and then the column to the right is the fixed effects plus that interaction term. And one of the things that I wanted to show you that struck us as being interesting is that in these models, with the fixed effects, as you're looking at these changes within neighborhoods over time, poverty is not a predictive factor. So these neighborhoods or census tracts that increase in the percent of the population or households that are poor isn't related to the maltreatment investigation rate over time. And I should say that you know, a lot of this, certainly this previous work, is using different models where, you know, poverty comes out a strong predictor, that sort of thing. So it's interesting in this fixed effects model that it doesn't. These are, I group these other predictors. They are sort of, in a sense, kind of behaving in the way you might predict as the percentage of female-headed households increase, as public assistance decreases, as unemployment, the percentage of vacant houses, and the percent that are owner-occupied, or percent of vacant houses, as those increase, the maltreatment investigation rate decreases, and then the percent public assistance and the proportion or percent of owner-occupied houses, as those go up, the investigation rates decrease. That sort of makes sense and is congruent with other findings. So the other thing I wanted to point out here that we found interesting is, without the interaction term, so the proportion of African American households in the census tract is not significant. And when you put the interaction term in, it's the census tracts where there's a high proportion of African Americans in 1990. So those neighborhoods, those ones that were kind of out on this end of that distribution, that are related to increases in the maltreatment investigation rate. So what does this mean? What we know about these census tracts with greater than 75% African Americans, there were huge population losses in them from 1990 to 2010. I just find this astounding. Look at this. This is on average a 30% loss in those neighborhoods, 30% loss in population, compared to a 3% loss in population in those neighborhoods or census tracts where there was a 25% or less proportion of African American households. It's sobering. And this population loss, coupled with the vacant housing, actually turns out to be a very strong predictor of maltreatment investigation rates. When you couple the population loss with vacant housing, with unemployment, with decreased assistance, what that basically suggested to our team was this notion of disinvestment. That we're looking at these tracts where there has been substantial population loss and disinvestment over time. And big surprise, that's linked to child maltreatment investigations, probably linked to a lot of issues. So this is where, I'm sorry the font's so small, this is where we then at this point in our study, so we find this interesting, we take it to our focus groups. And we ask our residential focus groups and we ask our social service worker focus groups, you know, one of the biggest predictors of maltreatment is vacant housing. What do you make about that? What does that mean to you? What would a neighborhood be like where there's a high proportion of vacant houses? And what I've done here is just excerpt some of the comments that these focus groups consisted of participants in our study, right? They did the interviews. And then they gave us permission to recontact them for these focus groups. So I just wanted to read a couple. The neighborhood has lost their investment, or the community has lost their investment in that neighborhood. So if there's lots of vacant housing, who cares? Probably local politicians don't care because you don't think that there's anybody to vote for you in that neighborhood. People who could be high stakeholders, who could potentially help families or be a support like your neighborhood down the street, they're gone. The other one, people have environmental depression. We were really struck by that term. People have, and there's a resident, one of our focus groups, people have environmental depression. Sometimes because the environment is bad, they're sad, they're stressed. Abuse of the kids sometimes is just a side effect. They love the kids, but they don't have coping skills to know that. Well, people like us that live in these areas where people are stressed out, you go to a mental health facility, or wherever you go to feel better, they'll give you a pill, but they can't solve your problems for why you are the way you are because they can't control that part of it. So that's a depression issue because it's sad when you look outside, you don't have enough money and can't get away. And then these are just some other, not just, sorry. These are other comments from this focus group number 1 with the residents. That's one of the reasons why I literally get in my car. I drive to Lakewood, or I might go to Middleburg Heights. I shouldn't have to come out of my own community. Feeling left behind. It's sad when you drive down the street. This yard hasn't been cut in months. And this house is boarded up. This house is falling apart. And then there's my house. There's a lot of hopelessness, overwhelming, and the feeling of being forgotten. So we were intrigued a bit with this notion of environmental depression, and basically in our second focus group of residents ran that term by them. You know, we said, hey, oh yeah.
I just wanted to add, as a middle-class resident of one of those neighborhoods, another factor is that you know you can't sell your house.
Uh-huh.
I mean, there's nobody who would buy your house and they're coming and they're stealing the front steps with houses and...
Yeah, that feeling of being stuck, right? I mean, yeah, that certainly came up in these two focus groups. So I was going to say, with our second focus group, we were intrigued a bit by the resident coining that phrase, environmental depression. And so ran that by, we talked with this group about vacancies, and then ran that term by this focus group to say, so one of the residents in the other focus group mentioned this, does that mean anything to you? What do you think? And these were some of their responses. It's kind of a contagious environmental depression. It's just a mess, and it spreads to you, and you're like, oh, well, I'm not going to go out and cut my grass either. Or, what's the point? Or like Miss C. So that's another participant in the focus group. We had them have letters, so we didn't have to refer to names. So like Ms. C said, having landlords that are states away, and this starts to happen at your house, and it's not your responsibility, but you have to take care of it. And then you look around, and it's overwhelming. You're like, well, he's not cutting his grass, and his fence isn't fixed, and no one lives in that house, so what's the point? Our focus groups of social workers. Again, we talked about the proportion of vacant housing. What does that mean for a neighborhood? What does that mean to live in a neighborhood like that? This term also resonated with them. Just a couple of examples, one from one from two focus groups. The first one, the feeling of being forgotten, a lot of helplessness. People feel trapped. It's contagious. Sometimes you notice that you feel it. Remember, this is a social worker who works in there. And then another group, it's environmental. Sometimes as soon as you pull onto the street or you turn into the neighborhood, you can notice it. You feel it. You know, oh, my client's house is somewhere on this street. So this, I think in summary with these groups, it was extraordinarily helpful, I felt, for us to get some contextual information around, the fixed effects model shows vacant housing. It shows these neighborhoods, and to get information about what does it mean from residents who live there, from social workers who work in these places. I thought this was really invaluable in helping us understand a little more about the context. Now, unfortunately, all the 400 resident interviews occurred before we heard the phrase environmental depression. So we couldn't go back to them. That wasn't in our protocol. But there were some interesting things. So one of the things we asked in these 400 interviews was, some people think that there's I forget how exactly we worded it. The idea was some people think that there's a connection between neighborhood conditions and child maltreatment, that in some neighborhoods more maltreatment happens, in other neighborhoods less maltreatment happens. Do you have any ideas why that would be? So just kind of generating some residential thought about this potential connection. And one of the themes that emerged from this was you are what your neighborhood is. I have a few examples here. If you live in a neighborhood that's kind of run down, boarded up houses, not clean, you kind of are what your neighborhood is. If you don't feel good about yourself, then I think everybody just goes down from there. The decay or destruction of the neighborhood, if you go outside and all you see is boarded up houses and weeds, I think that could lower your self-esteem a bit, And it's more or less like the type of area that you stay in. So your kids grow up in an environment where the window's broken, the trash is on the street. It's just like you're becoming a product of your environment. So that seemed connected to me on these notions. So I hope with this, one of the things I hope you got from our talk was the value we placed on this mixed methods approach. being able to get some of this information to provide more of a context for what we were seeing in the quantitative analyses. So I've got a few minutes left. I'm really excited to show you what we're working on right now. Forgive me, or us, it's still a work in progress, sort of half-baked. But well, that's not going to stop me from talking about it. So the idea behind this is, there is this notion of collective efficacy that is this working trust or cohesion or shared expectation of neighborhoods, of neighbors to intervene for common goals like raising healthy children. And it has been conceptualized, and there's also some empirical data to support this notion of it being an important piece of that pathway between neighborhood structural factors and child maltreatment. Collective efficacy somewhere in the middle. And so one of the things we're interested in is our neighbors' responses to maltreatment situation influenced by this neighborhood collective efficacy. So the idea being is if there's more trust, more working together, more sense of cohesion, are you more likely, for instance, if there's a situation, to go talk to your neighbor about it? Or, whatever. I mean, that's sort of the idea behind this. So this is what we're presently working on right now. So I have to thank Fred Schumacher here for putting in, I think it's John, right? John Quinones? Yeah. What would you do? Wouldn't this be the great experiment if you could kind of do what he did and have one of our scenarios is a wandering 8-year-old, and we'd give an 8-year-old a few bucks and have him wander around the neighborhood and kind of see what happens, right, with the people. Probably challenges with that on several levels. But we tried to do the next best thing. You've seen this show, right? Where they set up these situations and see what people do. So we tried to do the next best thing, which was present residents with a series of scenarios. So what do you think would happen in your neighborhood if, right? Your neighbors heard an infant or a very young child crying constantly. What do you think your neighbors would do in this situation? And then there's one for a child, if no one knew, 8 years of age or younger, wandering around. If your neighbor saw a child about 10 to 12 years of age destroying property. If teenagers were having a loud party at night. And then the last, if neighbors suspected that a young child, say between ages of 2 and 8, was being abused or neglected. So this was very open-ended, right? We just asked, what do you think neighbors would do? And people gave a lot of things. And basically, similar to that kind of standardized coding process, right, where you develop categories or buckets to kind of put responses that seem to cohere together, we developed 7 summary categories, if you will. And so one of them is to go to the authorities. And we use authorities broadly in this sense. So this could be calling up 696 kids, going to the police, going to child welfare, going to the school, talking to a teacher, talking to a social service staff member, something like that. Those are all considered authorities. Another option is going to the persons involved. So that would include maybe going to the family of that kid wandering around the neighborhood, or going to the kid who's wandering around the neighborhood. Going to neighbors, watching, kind of watch, see what happens. And then there's nothing, of course. Neighbors would do nothing, or I don't know what neighbors would do. And then other was anything that didn't fit in these other buckets. So what I did was made a category for each of the 33 possible combinations for 1 through 5, right? So you could say, these could all be alone, or maybe it's go to authorities plus go to neighbors, or whatever. You do that, you get 33 options, or possible combinations. And then I added 6 and 7. Right? Nothing or don't know. Everybody with me? Kind of weird, but all right. So this is what we got. So what would neighbors do? Or that's like John Quinones. I should put him up here. Yeah. And then we've got, these are the scenarios, right? Child wandering, child destroys property, infant crying, teens partying, suspected maltreatment. And what we got on the left, kind of the y-axis, are the most common responses. So contacting authorities only. That's what neighbors do. That's all they do. Or the only thing they do. Going to the people involved. Going to people involved plus authorities. And as it turns out, those 2 actions, interestingly enough, or these 2 alone, or the combination of them, handle 70 to 90% of what our participants said neighbors would do. One of those 2 or both of them. And then the others, don't know, nothing, watch only, and then everything else got lumped into other. But I should say that when you think about it, of these 33 possible combinations, it's actually a really small number that actually get picked. So these really, those three cover 70 to 90%. You're talking about like other includes everything else, right? And you look at it's, from 0.3 to, 10% in the infant crying. But generally, most of the response is in these. And it's interesting, as you might imagine, that people think neighbors would do different things depending on the situation, right? So we're literally just like, this is hot off, not the press. What's the right word? We're still in the middle of it, I guess you could say. And as a first pass at how do we try to look at this systematically or whatever, one of the things we thought we could do is let's break this down to the two basic categories. Do people say that neighbors would do nothing, or that they would do something, whatever it is? So just as a first pass, right? And you can see a predominant, there is some variability, right, in terms of the percent of participants who said their neighbors wouldn't do anything. Yeah, and then a majority says something. So again, just the first pass. I mean, there's a lot of ways we could slice this up or look at it. And then what we're interested in doing, we had our participants complete Sampson and colleagues' collective efficacy measure. So this is from their another real seminal work in the field, actually, in 1997. It was actually published in Science about neighborhood properties and wasn't just maltreatment. I forget, Jill. What was a lot of kind of adverse outcomes. But anyway, it actually got published in Science, which is saying something. And this measure, basically it's 10 items, and half the items reflect informal social control, and then half of them reflect the construct of sort of mutual trust cohesion. So I just gave a couple of examples of how likely is it that neighbors would intervene if children were skipping school and hanging out on a corner. That's sort of the informal social control. And then this is a close-knit neighborhood, be kind of a reflection of that mutual trust or cohesion. And interestingly enough, in our first stab at this, the variability between neighborhoods in collective efficacy is negligible compared to the variability within neighborhoods. So we're not seeing a real, like big neighborhood effect. Like this neighborhood's got a lot of collective efficacy. This one's not. The variability is negligible compared to the variability within. So we, first stab a logistic regression adjusting for individual characteristics and participant clustering. And this is what we get. The basic take-home message of this in all these scenarios is collective efficacy increases, the odds of doing nothing decrease. Now that sort of conceptually, I think, makes sense in all of these. I mean, it's interesting, some of the odds ratios are a little different, but that's sort of the basic message so far. So that's, I know it was a big build-up for this with me and so on, but it's sort of our first step, basically, because there's lots of ways, and that's something that we're thinking about now, as to how to kind of analyze these data in a way that makes sense. So take-home messages for this presentation. First, the need for caution in using and interpreting official reports and rates based on what we saw about the substantiation rate and that potential association with a policy change. The consistency in residents' perspectives about maltreatment definition and etiology over 20 years is stable. Response to potential maltreatment may be shaped by collective efficacy, but interestingly, so far, no neighborhood effect. And then I think very important, a need to reinvest in disinvested neighborhoods. And then lastly, I hope you gained a better appreciation for, although I'm probably preaching to the choir here, but that a mixed methods approach is really indispensable for studying this type of phenomenon. We've got some papers. We've been working like dogs to try to get some papers accepted around this area. And if you're interested in any, let me know. I can email them to you. We've even done one with comparing, where is it here? Yeah, comparing our caregivers' perceptions and attitudes toward child maltreatment. One of postdoc working on this project was from the Haruv Institute in Jerusalem. So he went back to Jerusalem and did a similar kind of pilot study in Tel Aviv. So we've got a paper out sort of comparing some of the results of those two sites. So this, of course, this study would be nothing without this magnificent team, cast of thousands. And we thank our sponsor, NICHD. So stay tuned. We hope to have more coming out, and thank you.
Unfortunately, we have a few minutes, but I'm sure Jim would also be willing to stick around if anybody had questions afterwards. I think you now know why we all like chatting with you. This was very, very fascinating. And if it did, but for the rest of you, there was some, what the qualitative brought to it was just,
Yeah.
I can't even really put words to it. Yeah. So any questions?
Yes.
I guess my question is, what do you think the credibility of the responses is? And I will put this in context. Last night I was at a meeting and the discussion was regarding calling the police for major crime. And the response of the group, and I was the only white person in the group, was we police our own. And I will compare this also to a situation where I was at somebody's house and kids from down the street came over and their mother, who allegedly has a significant drug problem, the kids have been in placement in the past, whatever, and she had apparently destroyed some large item, I don't remember what it was, and the kids were afraid to go home. And the only consensus of the people present was, we don't call the authorities. So I guess if I were to guess what the rates would be of calling people, these are more than average concerned citizens because A, in the first case they were at a meeting, and B, they were taking in kids who were having problems. These are involved citizens, and they're saying the last thing we're going to do is to contact any kind of authority.
Yeah. I mean, I think that's something we can certainly explore in our data. You know, if we can try to understand or examine sort of characteristics of these things on kind of a neighborhood level. And we also, I should add, in these interviews we did with residents, there was certainly discussion about the police and about police abuse of residents, that sort of thing. And I think that's something actually one of our team was interested in looking at. You know, in terms of the credibility of the response, I mean, I would agree. I mean, ultimately, who knows what goes on in someone's head to then come out and give a response to this. I would say that I do feel that there's more credibility. So we asked this question in particular. We asked, what do you think neighbors would do? What would you do? And I would say that I probably have more confidence in the person's talk about what neighbors would do. I mean, I can't help but think, what am I going to do? Tell this interview? I'm not going to kid abuse. I'm not going to do a damn thing. You know, am I going to say that? So I do think there's probably more credibility in that question around what neighbors would do. But ultimately, it is. It's a real challenge in this kind of work. That's why we could do the Quinones Schumacher approach with the wandering kid or something, and actually do an experiment and see. That'd be kind of cool. But I don't know what the IRB would think of that. Yeah.
So in kind of reference to what she was saying, you put up the numbers regarding the percentages of what the neighbors would do.
Yeah.
I myself was thinking that's kind of odd because given the neighborhoods that I work in, I don't think many of those people would call the police. So my question to you is, the people that you questioned or surveyed, what were their ages?
Yeah,
because I think that age,
yeah, I mean, on
older
average, what were they?
neighborhood
37, I think.
It was 37.
Well, yeah,
But
yeah.
police were only one part, right?
Yeah.
There's also calling the 696 kids.
Right, well,
Yeah.
even with that, I just thought that the number was really high to actually do anything.
Well, and-
Because a lot of people
Yeah.
that I work with, I don't.
I would say too, one thing to think about this is that, this is this sample representative of the residents in these these are people who, for whatever reason, agreed to have somebody who came and knocked on their door sit down and do 2-hour
Right, so
interviews.
that-
So
Yeah.
there is that element of it for sure.
Okay.
Yeah. And again, that's a challenge of our procedure in that sense, yeah.
Jim?
Yeah.
Sorry, would you be able to look at, though, the neighbors who reported they would call the authorities?
Yeah.
How many investigative reports were in that neighborhood?
Oh, yeah, we can do that kind of stuff.
Like some way how, aside like what the reliability is? 'Cause
Yeah,
If
yeah.
it's correlated, then you would think, well, then these responses are pretty
Yeah, we
high.
could look at that, the investigation rate, and yeah.
Seems like the two confounding issues are social desirability bias, and I really like your approach of asking what the neighbors would do, less social desirability bias there, but still
Yeah,
social
yeah.
desirability bias. And the difference is talking amongst a group of yourselves and talking with a researcher.
Yeah.
You're going to say or have different expressions of these things, but also, as you say, the people who agree to participate may be substantially different than the people who gathered in the living room.
Yeah. Chrissy?
I have a question about your conceptualization of collective efficacy. Kind of thinking about it in like a social capital, there are positive ways and negative ways that it could be used. So when you talked about the environmental depression or an environment that maybe had high levels of gang activity, there can be negative behaviors that unite communities or neighborhoods together that may not necessarily be, like, how does that tie into,
I agree.
like, what's the dark side
I'm-
of collective efficacy?
So the dark side of collective efficacy, if you ever watch The Sopranos. Right? No, I mean, seriously, there's a group with
Yeah.
high mutual
Yeah.
trust, high working for a common
Yeah.
game, right? I mean, that's certainly, it's certainly an issue with collective efficacy. I'm not sure I have a good answer for you
Yeah,
right now.
I'm just
I mean, I
curious
can
about
say
that.
that the items in Sampson's measure are geared towards what we would think of positive things, but that is certainly an element of,
Especially, again,
Yeah.
like what you said about the environmental depression really struck me.
yeah,
And, yeah, so.
yeah.
All right, our time is ended, but thank you again.
So thank you all for braving the cold.